All right, so let's go ahead and get started. I had to take my business suit off, my jacket, because it was like getting really hot. I see Zach is like the forever Hill staffer. You probably sleep in a suit. I'm just picking on you,
No
but
comment.
um, but thank you to everyone for joining this session. For the past 3 years, I didn't want to say this in the big session, but this is my personal favorite session. I think it's the most fun and where you can really learn a lot and especially now we're like a smaller group, so we can give each other feedback and really practice doing Hill meetings. And since Zach has been on the Hill for over a decade, he has a lot of good advice and a really unique perspective on being on that side of things from a staffer perspective, what is helpful, like what they want to hear, what they don't want to hear. And so I'm not going to reintroduce him since we heard from him in the other session, but he's been on the Hill, worked for several members of Congress, and he's now at a policy consulting group. And like I mentioned, he's not just a policy expert, he's also a very talented actor. So this will be really fun. And I wanted to start off by asking Zach to share with us what two examples of your best Hill meeting as a staffer and your worst Hill meeting as a staffer, so that we can all just like get on the same page and know what to do and what not to do.
Oh boy. Do we have enough time?
Just one example.
Just one. Okay. I will start with actually, I'm going to start with the worst one first, because I think it builds into a good transition. I first of all hope no one on this call works for FedEx. And okay, good. So I would leave them out of it if it weren't for the fact that it's kind of key to the story. So when I worked with Congressman Cooper, this was by far the worst meeting I was ever in. This was 2010. This was probably maybe September of 2010. It was either late summer or early fall of 2010. So this is just before the big Tea Party wave came in. We were, as Democrats, we were expecting to lose a lot of seats. And the political winds were definitely shifting against Democrats. So my former boss, Mr. Cooper, has a gorgeous view outside of his window of the Capitol dome. Like it's awesome. And if I had $1 for every time I heard him say, "Oh, I had to kill 3 people to get it," which if you've ever met the man, you would know he's got the driest sense of humor. I wouldn't need to be here. I could be off in the tropics somewhere where it's really nice. But so we had a meeting. It was with some pilots who work for FedEx. And there was a big fight going on in terms of reauthorizing the FAA. And there was a big labor provision battle. We don't need to get into that. But so it was 2 FedEx pilots from Tennessee that came in, and the boss gave his line, because one of the women was very impressed by the Capitol view. And the boss gave his line, had to kill 3 people, blah, 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 blah. And she laughed a little bit, and then she said, "Well, aren't you going to miss it?" And he just kind of cocked his head off to the side and said, "I'm not sure what you mean." She's like, "Well, you're not going to win in November, right?" And that was news to him. He represented a very safe Democratic district. He's still there today. But that was just how the meeting started, and it kind of started off on the wrong foot. She was woefully unprepared for the meeting. Unlike all of you who have a story to tell, she was kind of trying to go by talking points that she clearly had not read. And she asked a question about the particular labor provision, and Congressman was very curt, but still polite, about how Fred Smith, who's the CEO of FedEx, literally got into a almost physical altercation with the late former chairman of the Transportation Committee. And her response was, "Who's Fred Smith?" To which the congressman had finally kind of lost all semblance of patience, and informed her politely that Fred Smith was the CEO of the company she works for, and is like her ultimate boss. And the hardest part was, I mean, it was painful the whole way around. She just kept digging from there. And there was another pilot that was with her, and I felt so bad for her because she knew what a train wreck was going on and didn't know how to stop it and didn't know how to save her colleague from doing further harm. But it was not a very good meeting. I think at one point the congressman finally just up and left. And I had to send some emails to try to patch things up afterwards. So it was not good. So then to transition to the good meeting. I honestly don't have one that stood out. I mean, obviously the meetings I had with Lindsay were always great. But for the most part, for me, meeting with survivors and disease advocates, those were always good meetings. To hear personal stories as opposed to just some, talking points that were being regurgitated over and over and over, arguments that I'd heard 100 times before, to get to hear real people and to hear their stories and to hear how legislation really personally would impact them. Those were always good meetings. I will say, though they were still good meetings, the hardest meetings that I had were with the pancreatic cancer advocates. Those were always tough because you knew there was probably a pretty good chance you weren't going to talk to them the next year. And I was lucky enough to make some good friendships along the way, not just work wise, but to really get to know some people. And when you're there sharing like your honest life story, like capital L life story like that, it's those are just incredibly powerful, and they meant a lot to me when I was a staffer, and I'd imagine most staffers would agree.
So it sounds like a key to a good meeting is do a little bit of research and be yourself, tell your story.
And don't assume that the member or the staffer you're talking to's boss is not going to win re-election. Just don't.
Yeah.
Do that. Don't do that.
Maybe don't. So before we dive into the mock meetings, I just want to say our breakout manager wanted me to mention that if you want to click speaker view, it's at the top right of your screen. That will enlarge whoever is speaking at the time, or you can have it in gallery view so you can see everybody at the same time. And I think everybody's keeping themselves muted, but to remember that when you want to speak, to unmute yourself. And since we have a nice small group, I would love to just go around and do like a 30-second hi, what your name is and why you're here. And I'm going to go, I think everybody's screen is set up a little bit differently, but I'm going to go from the top of my screen. So Judy, would you like to introduce yourself?
Hi, I'm Judy Fulmer. I'm from South Carolina. My daughter is a teen cancer survivor, and just going through the process with her and seeing the major gap in cancer care for even small children versus teens and young adults has really given me a passion for cancer advocacy and survivorship.
Oh, that's great. Welcome. She's so lucky to have an advocate and a mom like you. All right, Alexa.
Hi, my name is Alexa Jett. I'm in Palestine, Texas, and I advocate for reasons just like Judy's daughter. Adolescent and young adults deserve better in the cancer care system, and they deserve to be heard and have their needs met. I'm also a papillary thyroid cancer survivor, and I'm sick of the misconceptions and the negative culture surrounding it, and I'm committed to being part of the positive change.
Awesome. Thanks, Alexa. Lauren, do you want to say hi?
Hi, my name is Lauren Fielder. I'm the Marketing Communications Manager for NCCS. So I'm probably stalking you on Twitter while listening to you at the same time. And this is actually, I'm fairly new to NCCS. I started in January, so this is my first Hill meeting with you guys.
And I have to tell you guys too that Lauren and I met when we both worked at Meals on Wheels headquarters. And so we've been in the public health world together for a long time. And so it's kind of cool that years later, now we're in the cancer policy world. So, yeah. Right. And Cora, do you want to introduce yourself?
Hello, I'm Cora Fahy, and I am a woman surviving breast cancer, but I'm also a provider of services to people going through cancer. So I kind of see my role as being an advocate for both sides, because I want to help my patients who are going through cancer receive what they need. And I really am passionate about a survivorship care plan. I think all of us need that. Because I see a lack of knowledge of a lot of my patients coming through. When I ask them what they have for cancer or what kind of treatments they have, they're so overwhelmed, they don't really know. And I think a cancer survivorship plan will help them when they're able to sit down and read to know what they need to look for. So I'm very, very passionate about this. And this is my second year with NCCS. And I am so impressed by this group, and I'm really glad to be part of it.
Thanks, Cora. It's so good to see you.
You too, darling.
Allison, I'll kick it over to you. Allison was with us on our very first day. She was in the advocacy plenary session.
Hi, my name is Allison Rosen. I am from Houston. I've been involved in NCCS, I think, for 4 years. I met them at Stupid Cancer. I'm an AYA cancer survivor, colorectal cancer. So I focus a lot. After I went through my treatment, I got involved at my cancer hospital, MD Anderson, and through a lot of the advocacy work that I've done, we have now a AYA clinic. And so I do a lot of policy related to adolescent and young adult cancer care, and survivorship is just one of the many things, but one of the most important things with the AYA population. And so I've done policy work for about 4 or so years, and I'm excited to try this virtually and do this and help train new advocates, because our story really matters. And so I'm excited to meet each and every one of you.
Thanks, Allison. Debbie?
Hello, I'm Debbie Setwain. I'm in Miami, Florida. I'm a breast cancer survivor now 10 years, but when I was diagnosed with triple negative breast cancer, also I was diagnosed with a genetic disease that is a BRCA1 mutation. So this is very important for my family also, because my mom died of breast cancer and her sisters, and now I was diagnosed with breast cancer, and it's very important for my sister, for my nieces and nephews and my kids to continue the care and to be able to have coverage, mostly because when it's prevention, some health insurance, they do not cover that those tests. So that's why I'm an advocate here and in other places. Thank you.
Thanks, Debbie. Betsy?
Hi, I'm Betsy Glossick. I'm from Cleveland, Ohio. I've been involved with NCCS, boy, for I don't know how many years now as a CPAT member. And it's one of the things that I've recognized is that it's, you know, and I've said this in videos too before, that you go to Washington maybe as a kid in junior high, you go there on vacation with your families, but when you can actually sit down and talk with legislators about the things that are important to you in your life, it's so impactful. I listen to the news totally differently now. I have a different worldview on it, but the reason that I do this is I am a survivor of melanoma from 2003 and breast cancer diagnosis in 2007. So fortunately, I'm in really good shape right now, but what as I notice as I'm aging through the process is and to speak to your point, Cora, this is from the other side, doctors don't even know. It is really difficult for me to get a good primary care physician who understands what's going on or what my concerns are. So if we can have a plan that helps us keep track of things, that helps the doctors understand what's going on, it's going to improve care across the board, no matter where you've started with this cancer, whether it's childhood or going through as an older adult. So thanks for the opportunity.
Thanks, Betsy.
Sure.
And Brian, I saw you nodding your head when Cora mentioned the lack of education in patients on the care planning piece. So I have a feeling you feel strongly about that.
Yeah, absolutely. Can you hear me?
Yep.
My name's Brian Webb. I'm an MD PhD student at Case here in Cleveland, Ohio. I do breast cancer research, and hopefully I'll have my PhD within the next 6 months. So that's a goal. But the reason why breast cancer and breast cancer research is so important to me is because I began my PhD about 4 years ago, and then unfortunately, almost as if twisted circumstance, I studied triple negative breast cancer. My mother was diagnosed with triple negative breast cancer. This will now make it a year ago.
Wow.
And so that was difficult, but she's fine now. She is now months out. I'm done with her chemotherapy. Now, what I was unfortunately astounded by was the complete lack of a network for support for her as a breast cancer patient. So unfortunately, my mother was diagnosed with breast cancer, and however was not able to, in this triple negative breast cancer, was not able to actually start treatment for 3 months as the hospital and her doctor tried to figure out something. And unfortunately, with triple negative breast cancer, we know that waiting even a month makes prognosis much worse. And it wasn't until I intervened myself that we were able to switch her doctors and actually get her to have some better health care. Based upon that, obviously I was already studying breast cancer, so obviously I just became more passionate in studying it and now advocating for it. And actually now I'm going on to try to learn a bit more about some of the holes in our support systems when it comes to the cancer patients. Right now I'm studying pancreatic cancer as well, as we know that there's disparities here, and we, on the research side and the medicine side, they don't know either. And it's unfortunate.
Yeah. Well, I'm so glad to hear that your mom is doing well, although she shouldn't have to have a son who is a doctor and a PhD to have to get good care. So that's why I think we're all here. And so we're really excited because we're always trying to connect with providers and medical students. So we're especially glad you're here, and I'm probably going to bug you later. So thank you for being here, Brian.
Of course.
Elise, would you like to take a second to introduce yourself?
Yep. My name is Elise Daniel. I live in New Hampshire. I'm a just shy of 15-year survivor of ovarian cancer. And again, that's one of the deadliest and also one of the cancers that really needs early detection for survival to be, it increases survival incredibly. I've been doing, I'm new to this group, but I've been doing advocacy work for the Ovarian Cancer Research Alliance. It's had various names over the years, probably for 14 years now. So I'm pretty familiar with going to the Hill and doing that kind of work. But one of the concerns is when I was diagnosed 15 years ago, Again, I live in New Hampshire. There were no gynecologic oncologists within a reasonable proximity to where I lived. I would have had to go up to Dartmouth, which is about 2 hours away, or to Boston, which is over an hour, but that's where I went. And I was lucky. I had a husband who could drive me. I was, and I had the resources, good insurance, but many women get their initial treatment from gynecologists, which are well-meaning, but not necessarily the way they should have their surgery and the whole process begins. So that information and awareness, and that's always been part of what's important to me. And I love the fact that this group brings people together from different cancers, and I can learn a lot. I would say one more thing of interest is that my husband's mother and her sister both had ovarian cancer in the 70s, both lost their lives to that. And so the odds of me then many years later, we know now they must have been BRCA positive because my husband is BRCA positive, but I am not. So, a whole weird juxtaposition of family circumstances, and, here I am.
Thanks for sharing that. We're glad you're here. Julie?
Hi, I'm Julie Catagnas. I'm in Albuquerque, New Mexico, and I'm a 21-year breast cancer survivor. I'm also a freelance medical editor, a field that I transitioned into after having been diagnosed and researching my treatment options. I went through the Project Lead advocacy program from it's NBCC, right? And as a result of having done that, I did the weekend program. I'm serving on an IRB, an institutional review board at the University of New Mexico Hospital as a community member, and basically provide the patient perspective in reviewing clinical trials before patients are, enrolled. And I also was accepted for the scholarship to attend the San Antonio Breast Cancer Symposium, but I didn't get to attend. It was in 2018, and my husband had a major health crisis that required me to be home. So I'm hoping someday to be able to go back and finish that. And what was I going to say? Over the years, I've made some calls to legislators about various, bills that were being considered, but I've never actually done, something like this on the Hill, or not even with NBCC doing their legislative day. And so I'd like to get more involved with NCCS and add another organization, to what I'm working with now. But this is the first time I've had any connection with all of you. And I was informed about you by another really long-term advocate down in Texas who gave me the information. And I'm looking forward to getting more involved. So thanks for having us.
Thanks, Julie. I'm so excited that this will be your first Hill meeting. Unfortunately, it's not going to be in person, but this is always maybe a good transition to do the phone meeting. And then next year, hopefully we'll be back to in-person meetings. Lisa, do you want to take a second to introduce yourself?
Hi, sorry. So don't look at me. I ran and did some exercise during the break.
You look great. I think your background's good.
Working from home. So I actually do public policy for Force. So Debbie Sedwin is one of our most involved advocates. Our focus is hereditary cancers, mainly breast, ovarian, prostate, pancreatic, and colon. And I actually work with our advocates. So I'm really here just to listen and to get ideas for how to interact with some of our advocates. I am not a survivor. I have a BRCA mutation, but I have not had cancer. But we serve both folks who've been diagnosed as well as those who are high risk. So just happy to be here. We respect the work that NCCS does. You guys are a great partner, and thanks for all you do.
Thanks, Lisa. We love working with Force, and thanks for everything you do. Thanks. All right, Carol, do you want to take a second to introduce yourself? Oh, I think you're on mute. It looks, sorry, we still can't hear you. All right, we can move on to Sandy, and then Carol, you let us know when you can unmute.
Hi, my name is Sandy Smith, and I'm actually an oncology nurse. I've worked in oncology for several decades, and the past 8 years or so have been directly involved in clinical trials. And my interest in NCCS has been sporadic over the years, but over the last few years in particular, I had a nephew and godson who was diagnosed with colon cancer, and unfortunately, trying to connect him to the right services, it took my network of knowing physicians through the clinical trials work that I've done across the country to get him into the most appropriate care. And then shortly after losing him, my husband was diagnosed with prostate cancer. And just recognizing that, you know, in both instances, we were well insured, the hardships that it takes and the friends and professional contacts that I had in order for us to feel confident in the decisions that we were making means there's still a lot more work to be done. So I would like to get much more involved with NCCS.
Thanks, Sandy. We look forward to working with you.
Thank you.
Sarah, do you want to introduce yourself?
Hi guys, sorry about my reception. I can't get the video to work, but this is Sarah Farnham. I'm from San Diego, California, and I am roughly a 3-year survivor of acute lymphoblastic leukemia. I found NCCS through Stupid CancerCon, as well as Allison. I guess my reasoning for doing this, I've been to the past 2 symposiums, and the first time I was extremely nervous, but it kind of opened up a lot of the gates for me to share my story and feel very comfortable doing it, and it kind of shaped a lot of my experience with doing a lot of outreach, particularly with the young adults in my community here in San Diego. And I guess a huge reason why I'm doing this as well is just being someone who, for 3 years, you know, single younger woman, feeling I was navigating a lot of this on my own, really didn't have a huge support network, and just realizing just how much you have to become a self-advocate to get proper care. So I think it's really important. I do really believe in a lot of the care planning acts, and I think that would have been really helpful, especially for someone like me who had a 3-year protocol, and I knew I was going to survive it, but it was still overwhelming nonetheless. And I just finished that. I'm very happy about that. But I am happy to see a lot of familiar faces and to continue this process. So thank you.
Thanks, Sarah. And I see Carmela. Do you want to take a second to introduce yourself?
I'm Carmela. I'm in New Jersey at the height of COVID, and I'm a cancer survivor for 16 years now. I first was diagnosed with colorectal, came through that, went on a clinical trial at the end of my treatment. And as a result of the clinical trial, I developed ITP 7 years later in 2011. Have had multiple surgeries and multiple treatments, and came through that. And this March, I came down with influenza A, even though I had had my flu shots and pneumonia shots. And as a result, by the time I recovered and was ready for an additional same-day surgery, everything was in lockdown here in New Jersey. So I was finally able to get tested and go in for same-day surgery last Tuesday. So I'm just a week in recovery, and it's wonderful because same-day surgery and robotics make the healing process so much easier. And things are so different than they were 15 and 16 years ago. I should also tell you that I am in healthcare for the last 35 years of my career. And I was always an advocate for myself, going in knowing that I wanted to know everything that I would need ahead of time, including all the medications for all the symptoms that might occur, because I am single and I do live alone. And at the time, my family was nearby. They're now out in Arizona. So it's been quite an eye-opener. I have worked with my congressman personally. I have been in commercials for him and his re-election. So I'm able to get access to him a little easier, which I take advantage of. But what's hitting home with him is that his mother passed away of breast cancer approximately 4 years ago, when I became a member of NCCS and we started working with him. He is Congressman Donald Norcross from New Jersey, along with Senator Booker from New Jersey. So I have personal relationships with them, and I think we've made great strides with each of them. And I can call up on the phone and not have any issues speaking with them. So as far as I mean, are we talking about the Cancer Care Planning Act and CARE Act 2019?
Yeah, we'll be, the asks are for the paid leave expansion to include cancer survivors and for the Cancer Care Planning and Communications Act. So we'll get a chance to practice those asks in just a bit.
So I've really become an advocate here locally for the hospital that I attend, and also in my community, because I'm politically involved. So a lot of that, I take up a lot of that time between my health and those advocacies. But I really believe that the average person, and I'm not the average person because of my background, is really involved with their care, but they're also afraid. And so what this CARE Act will do for those individuals, it, besides bringing awareness, let them know that these are standards of care, not just for them, but for many people and for all cancer survivors.
Yeah,
that's the way I look at it, and want to just put that forward.
Yeah, thank you, Carmela. Thank you so much. And I just want to make sure I get everybody. Karen, do you want to say hi to everybody?
Hi there. I'm Karen Dennis Collar. I'm a clinical social worker in Lawrence, Kansas. Actually, I live in Lawrence. I work at home right now, but I work for the Masonic Cancer Alliance, which is part of the KU Cancer Center. So I actually am new both to NCCS and to the cancer world. I came from primary care most recently, and I have a mental health background before that. And so it's interesting and helpful for me to hear from survivors. About half my time I'll be working with people who are with individual therapy, who are engaged in cancer treatment, and helping them through their cancer journey. And then the rest of my time I spend working with cancer centers and developing programming, psychosocial programming to help cancer survivors and patients who are in cancer treatment. So it's useful for me to hear about all the work that NCCS is doing, and hearing people's survivorship stories is really useful. So thank you very much.
Thanks, Karen. We're glad you're here, and for your perspective and with the psychosocial piece of cancer care. That's something that's really important to us. So thanks. Okay, did we get everybody? I think there's someone whose name is iPad2, and I wish I knew your real name. Do you want to introduce yourself? No? Okay. All right, should we kick things off? So Zach, I'm gonna give like a quick little perspective of so far what's been my experience with the Hill meetings not being in person, because I think it's definitely different this year. And it's a little more different than I was anticipating when we started getting back into doing Hill meetings again. I was kind of hoping that they would be open to doing virtual meetings like this, because it's really nice to be able to see some of the social cues. Because like when you're over the phone, you have no idea if they're just like reading something else or not listening at all or getting ready to speak or have a question. So there's like that awkwardness. And unfortunately, every single meeting that we've had so far, even with coalitions of larger patient groups with Hill staff and members, has all just been phone meetings. Nobody wants to do a virtual meeting. And so we had some emails about people asking whether the Hill Week meetings are going to be phone or video conference, and almost all of them are going to be phone. There are 2 members of Congress who are joining, and I think they want to be on video, but otherwise it'll all be over phones.
No one wants to put on pants.
Yeah, right. And so does anybody want to just like dive in and be the first volunteer to run through either whatever you're comfortable with, if you want to talk about the paid leave policy, or if you want to talk about care planning, and Zach can be our pretend staffer, since he was once a real life staffer. He plays one very well.
Played one on TV.
Yeah. So anybody want to volunteer?
Don't everybody jump at once. Come on now. I don't bite.
Okay, if I go first, will somebody volunteer later after me?
I just have a question, Lindsay. So I unfortunately was not able to join on the earlier segments earlier this week. So is there a place where the fact sheets are published that I can go back and look at?
Yes, and actually Lauren can include it now in the text box, but it'll be posted on our website. We're also going to send out an email with the Hill meeting information.
Okay.
That one pager, and the one pager is for you also. It helps with just like talking points. What I do is I'll like highlight key things that I want to make sure that I cover. And then that page is there as a resource for me, which is, I think, one benefit of doing the calls. You could literally, you have it in front of you and you can read, and you don't have to be, which you shouldn't be embarrassed reading a one pager in front of a staffer anyway in person, but it's kind of nice. You can pretend like you know it all in your head, all of the FMLA policies and the complex care planning specifics. But yeah, Lauren just linked to it there. And that one pager too, feel free to email it to the staffer as well after you meet with them. All right, Zach. Alexa, did you want to go first, or
do you volunteered if you went first?
Okay, all right, fine. I was kind of hoping that. No. All right, so we'll do like fake phone in.
Ring, ring, ring,
all right.
Ring.
Hi, Zach. Thanks so much for taking the time to meet with me.
Good to be here. Thanks for the opportunity to talk.
So I'm Lindsay Half. I'm with the National Coalition for Cancer Survivorship. And at this time, I usually talk about the history of NCCS and that we work on policy issues and all that stuff. And so one thing I really wanted to mention today was a policy that was included. So we can pretend like you're on the Senate side, Zach. Okay. So,
I'll take it.
So there's a paid leave expansion policy that was introduced in the House bill, and it would allow cancer patients who need to stay home longer throughout the COVID-19 experience, since cancer patients are more vulnerable to the coronavirus. If they get it, their outcomes could be much worse. A lot of patients, we hear from are really nervous about going back into the workplace, or their oncologists are recommending that they do not go back to work because they would be exposed to getting the coronavirus, and it would be detrimental to their health. And so we want to make sure that cancer survivors are protected throughout this devastating time, not having a paycheck. And most cancer survivors, have a huge financial burden of the cost of care anyway. And so if they are not able to go back to work, and aren't able to, have a paycheck and, feel comfortable going back into the workplace. That's something that we're really concerned about. And we've been hearing from cancer patients all over the US. And so we think it's a really important policy that should definitely be included in whatever next package Congress comes up with to address the impacts of the coronavirus.
Great. Well, that's great. Well, who's the lead senator?
So right now there isn't a lead senator on this issue. So as you know, the House passed the HEROES Act and that language was included. But right now the Senate leadership hasn't announced plans for what will be included in the Senate package.
Gotcha. So there isn't a specific Senate bill, but this was part of the HEROES Act in the House? Yes.
And we just want to make sure that that piece specifically is included in whatever package the Senate comes up with.
Great. Well, that's good to know. I really appreciate hearing that and hearing those stories and understanding how the COVID crisis is affecting folks like you and cancer advocates out there. So I'll be happy to take that back to the senator. And I don't know when negotiations are going to start on the Senate side, but we'll certainly keep an eye out, and I'll be happy to make sure this is part of our asks.
Great. And will you please let me know if you or your boss has any questions about the specifics of paid leave policy, or if you need patient stories to articulate the need for this policy? I'd be happy to send along some more resources.
That'd be great. Patient stories are always very helpful, especially if you have anybody from our state. We'd love to talk to them and discuss this further. But in the meantime, we'll be happy to take a look at this and we'll let you know if we have any other questions.
Great. So are you also from Indiana?
I am indeed. Yes, I am.
Well, where did you grow up?
I grew up in Fort Wayne.
Oh my gosh. My second cousin sister's friend lives in Fort Wayne.
No kidding. No kidding.
Basketball player.
Obviously. They go to Snyder or Northside or
both.
Both. They went to
wouldn't believe it.
Both high schools at the same time. Huh. That's pretty impressive. Well, I went to Northrop, so I don't like either of those other schools.
Yeah,
so,
I don't either.
So I don't like your cousin's best friend's roommate or whatever it was.
Clearly, I've never been to Indiana.
Clearly. Just don't say the senator's not going to get reelected.
Yeah, right. I'm going to have to take that out of my usual go-to script.
Good idea. Good idea.
Okay, so does anybody else want to give it a shot? I think usually it's either in the beginning, I always try to how are you doing? This is such a crazy time. Are you having a lot of meetings? Where are you from? Sometimes that helps. Sometimes they don't care. They're like, yeah, okay. What do you want? And that's fine. They're typically having meetings back to back. Don't take it personally.
I will say, because of the points that you made earlier about the social cues and the physical cues, I would leave that stuff. You can do it at the beginning, kind of a little icebreaker kind of thing, but I would make that very, very maybe 30 seconds tops. Because again, if you're on the phone, you won't see their eyes rolling necessarily. So it might be better just to maybe keep that very brief. I think spending as much time on your story and is the most important.
Great. All right, Alexa, you're up.
Hi, Zach. So good to meet with you today.
Good to meet with you as well, Alexa.
I understand that in these times you hear so many important issues and there are so many things going on in the world, but as your constituent, I would like to talk to you about some issues that are important to me. I am Alexa Jett. I am from Palestine, Texas, and I was diagnosed with papillary thyroid cancer at the age of 25. I'm here to talk to you today about a few very important things to me and my community, as I'm also here to represent the National Coalition for Cancer Survivorship. We would like to discuss the Cancer Care Planning Communications Act, or HR 3835. And I would also like to talk to you about paid leave for particular populations of individuals. Like so many people diagnosed with cancer as a young adult, I experienced many challenges, but thankfully, due to the provisions in the Affordable Care Act and COBRA, I was able to stay on my mom's excellent insurance while I received the most expensive parts of my care. Also, like many young adults, there are some issues when it comes to workplace. Whenever you're a young person, you're just starting out your career, and it's unfortunate that you may have had to put college on hold or had to take a leave of absence from your work. Nobody wants to stay home. No young person wants to delay their career more than what they have to. But it is important that we keep the health and safety of people in mind. So what I'm asking for is to consider people who may have pre-existing conditions or chronic conditions, and especially who have had cancer in the past, to be able to take leaves of absences from their work if they cannot work from home, that they can be able to be protected from the coronavirus crisis.
That's great. I'm going to go ahead and stop right there, because could you guys hear the dog barking? A little bit, a little bit.
I thought maybe it was a kid somewhere.
Yeah.
No, I specifically started playing a video of dogs barking to try to trip you up, and Alexa just powered through.
It happens to everybody now.
Yeah, I thought, man, she is really good at this.
Nothing was going to get Alexa off track.
Absolutely. Well, I'll just take it as you did it anyway, Alexa. That was really good. No, that was
Thank you.
very good. But
Yeah, that was incredible, Alexa.
Thank you.
yeah, and one of the reasons I did the little dog thing, even if only a few of you could hear it, was right now those are the kind of things that are going to pop up that you're not used to necessarily. So it's important to try to keep focus, even if there's stuff going on in the background that you can't help. My not quite 3-year-old was bowling a little bit ago. I'm glad you guys couldn't hear that. But those are the kind of things that, like, right now, these are the kind of things that'll jump out that could kind of trip you up. So it's just, be mindful of it and be willing to kind of roll with it. And so just a little thing to keep in mind, but that was great. That was well done. Again,
Thank you. I appreciate that.
Story is very helpful and very, very impactful.
Does anybody else want to volunteer to go?
I'm all out of dog videos.
Up on you could either do care planning or paid leave or both.
This is Sarah. I'll give it a shot. I'm going to try my video as well. Okay. Hi, everyone.
Hi, Sarah.
Okay, I'll give it a shot. So are we starting now?
Yeah, actually, I want to say first too, the first time that I met Sarah, we were going to meet with Nancy Pelosi. So Sarah, you gotta you're good at this point.
Okay, well, you're kind of building me up a lot. I'm getting nervous, but thank you. I'm a little rusty here, but I definitely want to do that. Thank you for saying that. So I'm walking into Senator's office. Hi, Senator, how are you?
Doing well, thank you.
Okay, great. So I think I've actually met with your office before in the past 2 years. Just to recap, my name is Sarah Farnham. I'm 37 years old. I'm a survivor of acute lymphoblastic leukemia, of which I've actually been undergoing treatment for the past 3 years. I'm actually here to talk to you about expanding paid leave for a lot of people with chronic illnesses or people whose immune systems are low, and actually people like me in particular. Since I've just finished chemotherapy, 3 years of it, my immune system is very compromised. And there's many Americans just like me in this exact same boat. Just to give you some context, back in January, I came down with what my doctor thought was a common cold. It wasn't even the flu, and I was out for about 6 weeks. It took a lot of treatment to get me back to health. And I'm really hoping that you can help push through expanding paid leave for constituents like me.
Right. Well, my heart goes out to you. Glad to see you're doing well. I hope you're staying as safe as possible right now. I will say I just spoke with Leader McConnell about this a couple of days ago, not about cancer specifically, but I have heard from a lot of folks. I'm also hearing from a lot of my constituents that we can't keep putting all this on the country's credit card. We've already spent $2 trillion. I don't know where we're gonna find another few billion or another $1 trillion to spend on this. So if we've got to spend these federal resources and allocate them as efficiently as possible, why should I pick cancer care, cancer patients over any other patient?
Oh, I definitely agree with that. But this actually would be to protect a number of different patients with immunocompromisation or who are at risk right now. I'm coming on behalf of the National Coalition for Cancer Survivorship, but this would extend to a number of people. I understand costs are definitely something that should be considered, but these are measures that would help literally save lives, as a lot of people do not have the choice, people like me, to go and telework. They only have a choice to work in the front line. And so I really hope that you would consider this and urge you to please push this forward, because it would be helping a lot of people, especially people like me. But as I said, extends to other chronic illness, immunocompromised individuals as well.
So it's not just for cancer, it's for a lot of people. That's good to know. I really appreciate you filling me in on that. And I'll be happy to take a look at that. And I'll be talking at our next policy lunch with Leader McConnell, and I'll be happy to bring this up.
I really appreciate that. Thank you so much for your time, and please continue to stay safe. Thank you.
Thank you. You too.
Thank you.
That was great.
Hose, look at that. Nice.
Yeah, that was so good. And I
I'm
think
no Nancy Pelosi, but
that was a good, I guess, persona to take on, Zach, because that is, right now the cost issue is really important. But Sarah, you framing it as this is literally saving lives was perfect.
Yeah, and again, because you said I was such a great actor, Lindsay, you put a lot of pressure on me. I decided to try to play a Republican senator. That was not easy for me. But do be prepared. I don't know how many of you are meeting. The meetings you have are with Democratic staff or with Republican staff. But if you're with Republican staff, you may get those kind of questions.
Yeah, and Sarah handled it.
Biased here, but it's hard when we're literally talking about saving lives, why dollar amounts are as important as they are. But you will start hearing some of that from Republican staff. It is definitely something that is being talked about on the Republican side of the aisle. Is we've already spent $3 trillion. Why do we need to spend another $3 trillion if the economy is getting better, and et cetera, et cetera, et cetera. So just be prepared for that. You're not likely to get that same kind of reception on the Democratic side, especially since the House passed another $3.5 trillion bill a couple months ago. But just be aware of that.
Yeah, and Sarah did a great job of staying with the talking points and just staying calm and just reiterating the ask, because other than saying it's going to save lives, and I think your point about there are millions of other people just like me was really powerful too, and I think that helps for sure. Okay, anyone else want to give it a go? Cora, you speak so eloquently about care planning. Oh, sorry, you're muted. Does anybody else want to talk about care planning?
There.
There we go. Now we got her.
Yeah, I'm not really good at unmuting myself, but I'm afraid to follow up after those two. I'm not as articulate as both of those, and I'm slightly scared now.
Don't be scared. So Cora, let me ask you a question. I'm sensing, is this an Irish
Yes.
dialect? Yeah, then just talk. I won't say anything to distract you. I can dig the Irish accent, so.
Well,
I was totally going to say that, Zach. I was totally going to say that.
Thank you. Well,
You're selling yourself very sure. I remember the Irish accent helped you last year. I'm just going to put that out there too. And you were very charming. So I'm just going to put that out there. So.
Love seeing you, by the way, Sarah. So good to see you. I don't even know where to start now, but I get nervous when I'm on these kind of things, so I don't do so well. And I actually suck at role playing. I'm actually much better in the moment, but I used to, I want to go back to the reason why I work in the medical field, because I didn't actually explain that. So I'm a physical therapist assistant, and I work in oncology rehab and with lymphedema patients. So for me, the most important thing is knowing that my patients have got the tools that they need to be able to advocate for themselves and to be able to get the best care that they need. So for me, the Cancer and Communications Care Act is hugely important because it allows people to be able to take that plan with them as they go through their journey and to be able to monitor what types of side effects are coming down the road and what plans they need to do in order to get tested for things. So that, to me, it's a no-brainer. If you pay for it up front and have a plan started, down the road, it's going to reduce the costs of healthcare because you've got patients who can advocate for themselves. They can go in and they can get those tests done and prevent things coming down the pike. So for me, that's the most important thing. But I also love the fact that the expansion of the act to allow people to have paid leave is huge during this COVID-19 time. I'm a frontline worker myself. I have worked through this whole process. I've done the testing tents. I've retrained in all of these different jobs so that I could get out there and work. But there are a lot of people who don't have that opportunity and who really shouldn't be on the front line. So they need that opportunity to say, I can step back, I can take care of myself and my family and not lose my job. So those are the things that are really important to me. And I think they're important. They should be important to all of us, to whoever I'm even talking to on the phone, because you may not be affected by cancer personally, but you will know somebody who is. So.
Cora, just say that. Just do that. Do that tomorrow and you're going to be great.
Oh, thank you.
This,
I will never get an Oscar. I swear to you, never get an Oscar. I suck at this.
I'm an Oscar short of an Oscar myself. So.
Oh no, I was actually going to give you an Oscar for the Republican. You didn't do that. I was like, the Oscar goes to Zach.
I will say though, as a moment of personal privilege, Cora, one of my clients is actually the lymphedema advocacy group.
Oh, I love them. Yes.
So do I. But that's yeoman's work you're doing.
Thank you. Well, I need to get more involved with that advocacy as well as the National Coalition for Cancer, or for Breast Cancer. I want to get involved with those.
Right. Right. Well, all of these groups do such amazing work. Obviously, Lindsay's the best.
She is. Yes. Yes. And on a personal note, can I just say that last year, going to Capitol Hill and actually sitting down and being in that whole environment was huge for me because I'm a naturalized citizen. I became a citizen in 2008. So to be an immigrant and to be on Capitol Hill and to be doing something like this was hugely powerful for me and life-changing.
Yeah. Well, and I'm really glad you brought that up because that is one of the things about doing Hill visits that I hate that. I'm not sure how many of you are new this year. A couple of you had mentioned that, but that is one thing that you do miss about having to do it virtually or on the phone is not having that first person being in that room, you know, with the staffer and being on the Hill. There really is a lot of power to that.
Yeah.
But at the same time, there is a bit of a home field advantage for getting to be at home and maybe a little bit more comfortable. Maybe that's not quite as intimidating as walking into a, you know, congressman or senator's office, or going, you know, walking into the Capitol and stuff like that can be a little intimidating too. So for those of you on your first try, that's something else to keep in mind, that you've got you're in your own surroundings. Maybe that'll take a little bit of the pressure off, but that you don't have to worry. You guys are all fighting for folks who are all dealing with something far tougher than having to go through a Hill Day visit. Just be yourself, tell your stories, let them know how important it is to you and how important it's going to be for them. Cora, you mentioned it. That was a great point about how it may not affect you personally, but it's going to affect somebody you know. I was actually fairly lucky that cancer hadn't impacted me much. About 4 years ago, my father was diagnosed with bladder cancer, and then a colleague of mine on Capitol Hill was 30 years old, didn't smoke, perfectly healthy, went off to college in London, and was coming up and down the stairs in the flat that she lived in with her sister and brother-in-law, just getting really winded, and decided to go get checked out and see what was going on, and was diagnosed with stage 4 lung cancer, totally genetic. And she fought hard, but she passed away just before Thanksgiving last year. So even for those who aren't specifically impacted by cancer, they're going to know someone who is, and making that touch with somebody is pretty powerful. You guys aren't in there asking for tax breaks for corporate jets. You're trying to save lives. And I think that's a pretty powerful message, especially, you know, right now when people are, you know, the loss of life is taking on a bit of a new importance. So keep up the great work.
I think that's a beautiful. Oh, sorry. Go ahead, Allison.
I was gonna say, I don't want to practice because I need to read everything a little bit more carefully. But what's helped me in previous years was going to my senator or congressman's page, you know, reading about them, sort of doing a little bit of background research. And so I have a little bit of an idea of what they like to do for fun, or what their priorities are, or what they have previously focused on or voted on. And I'm in Texas, so not everyone's Republican, but a lot
Not everyone,
but a lot of my meetings, I've gone in knowing that no matter what I ask for, they're most likely going to say no. So I focus really on the story, and through the years, I've realized that a lot of the people I've talked to, either the rep or their staff member, they all have been affected by, like you said, they've all been affected, either some of them directly, some of them, you know, it's their mother or their father. And as soon as you make that connection, it doesn't really matter what you're asking for. The likelihood of them supporting it's there. So if they said they've been affected, I think you know, I always take notes. So I have like a notebook of people I've talked to as far as, you know, the health rep or this rep or whatever. But I think you have an in the minute, you know, you ask if someone's been affected that they know, or maybe themselves. But doing the research about who you're going to talk to ahead of time will help. So you sort of go in knowing that, okay, well, I don't necessarily think they're going to agree with this, but I at least my impact can be in my story, and hopefully that can touch them in a positive way. And I think the other thing I was trying to think, I was going to ask a question to Lindsay. So if I have a relationship with some of the people that I've talked to over previous years, if that appointment is set up via phone, would I be able to like email them directly and ask if they'd be willing to do a Zoom call?
Sure. Yeah.
Okay. I mean,
I will say Zoom may not be the primary method. If you have like maybe Microsoft Teams or WebEx might be another option. There's been concern about security with Zoom. So I know there's a lot of Hill offices that just won't do anything via Zoom.
Okay.
But not necessarily, but other kind of platforms like that may be an option.
Sure. Yeah, I'll ask, and then maybe I'll reach out to you, Lindsay, if they're like, yeah, because I have a Zoom account through work that is secure, but I want to do whatever is more comfortable for them, if it's even possible. Because I've realized that a lot of meetings I've had over the phone over the past few months have been fine, but if I ask, they're usually willing to do an in-person call so they can. I mean, I'm very visual cues, although I guess you're right. If you have it, a phone conversation, then you can just read it. But I never like to necessarily pre-plan what I'm going to say as far as my story. I go on like the cues that they give me, except for obviously the name of the bill and who it's going to help and all that. So I maybe make my top 5 points. They're written down. Rarely do I actually have to use that when I go into their office because, they make it very comfortable for you. No matter if they agree or are going to disagree, they're usually really, 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 really nice. And that's sort of a feedback for the newbies that haven't done it before. I was very nervous my first time, but.
And Allison, your point about taking notes reminded me, I wanted to tell everybody that the session going on, breakout one, track one, how to tell your story in a nutshell, is happening right now and is being recorded, and it'll be up on the website later. And that is a really nice complement to everything that we've been talking about. And you'll have access to worksheets that break down like the introduction, share your story, talk about the ask, and then close it out. So that's a nice thing to have to kind of organize your thoughts and your message. So just wanted to plug for that.
Yeah, that helped me a lot.
I'm so glad. And it's fantastic because they have a generic one that you can use, not just for Hill meetings, but any setting where you would be sharing your personal story. Then there's one specific to paid leave, and then a worksheet specific to the care planning. So it's very, very helpful. Highly recommend. And that's in the link that Lauren shared in the chat box there. So.
Yeah, I would agree with Allison that I haven't really had a chance to dive into what the specifics are of everything for this year. But what I do want to tell everybody, especially the newer people, is that, so one of the things I left out of my story is that I work for an international organization now as the chair to kind of pull all the patient advocates together. So I work with patient advocates of all different cancer types in integrative oncology. And I think sometimes we tend to silo ourselves according to our cancer type, breast cancer, colon cancer, prostate cancer. But from my perspective, what I see is that we all have these same issues. So, don't feel like you're going in and talking to someone about your specific cancer and that it's not going to be impactful. You need to remember and address that issue with them, that it's not just my type of cancer, but this is happening with everybody, for the millions of people in this country that, have this disease or are affected by it in one way or another, be they caregiver, be they patient, whether they're young, whether they're older, we're all affected.
Yeah, absolutely. Thanks, Betsy. And Betsy has a really great Facebook page called Cancer Conferences. Maybe you can post that again today in the CPAT.
Yeah, absolutely. It's cancer conferences, meetings, and events. So the idea was to be able to have, if you have a meeting or there's something going on that you want to share information, so we can kind of share our resources and so we know what's going on out there, right? And we don't allow anything on there that's selling product or anything like that. We really try to monitor that very, very closely. So yeah, find me on Facebook, or I'm happy to post the link to it and ask to be a member. Yeah, thanks, Lindsay.
I need to read up on some of this as well. This was a little bit new to me. I've done some advocacy work on the Hill with Childhood Cancer Action Days, Teen Cancer America, other things, but this is my first with NCCS. But this care plan legislation, to me, this is huge. Having a care plan, knowing what to expect, would have been so helpful as my daughter, my whole family, and I walked through her treatment, given a roadmap, so we knew kind of when certain dates of cancer, not cancer, but treatment were coming. She'll have chemo on day 29. Day 29 was always a huge day for us for some reason. And we're gonna see you in clinic, but we never really knew. We only knew, okay, she'll be hospitalized for these 2 days, and she'll be in clinic on these days, and she'll have a spinal tap on these days and receive chemo. But we had no idea what was coming at all. We had no clue. The day that she started treatment, we were given prescriptions for Ativan and Atarax and oxycodone. And we were told, we will push through the side effects no matter what. Just, we are gonna go, we are gonna push hard, we're gonna keep this going. And this was for the next 2.5 years. So when things came up, if I called the clinic, I was told, oh, well, give her this. Okay, but that's not working. We got the baseline prescriptions. If you have nausea, you take this. If you have pain, you take this, period. But what happens when those don't work? We had no palliative care support. She had all kinds of complications and things. And what I was told more often than not was, we don't see much of that. But through the childhood cancer community, I learned that they do see a lot of it. It just would have helped so much to be able to anticipate and have a team in place to address these things. So I can see the value of care plan.
And I think the way, that you just articulated the personal value it would have been to you, it's not just saying this would be helpful for me or will be helpful for me in the future. It's like imagining like you're doing this work on behalf of people who are diagnosed in,
Exactly.
So yeah, that's a really helpful personal story.
So Judy, you brought up the idea of being attached to the provider team being very, very efficacious for a patient. And honestly, I think it's quite a darn shame that prices and participation really varies as to whether that's possible, even within the same hospital system. So what I ran into was that connected to the same hospital system here in Cleveland, the initial doctor my mother saw I'm sure he was a great doctor, but he did not know how to manage her cancer. And with triple negative breast cancer, gave her those 3 months of uncertainty and basically put on her doorstep, do you want me to cut it out or hit you with radiation first? What do you want? And that's it. No other information, no anything. And I went to that appointment with her, and I realized at that moment, good Lord, I now need to step in and actually start doing stuff, because unfortunately, without something like the Cancer Planning and Communications Act, if it's not mandatory, it doesn't happen for everyone. And after that appointment, I remember the walk back to the car being one of the longest walks ever. And we got into the car, and my mom stopped and cried in the car for minutes because she didn't know what to do. And I told her, well, we're going to find you another doctor, and we're going to find you another team to work with, because this is a lot to work with. And the idea that he would just give you those two options and then send you on your way is heartbreaking. Now, luckily for us, because I knew multiple people, I knew the leader of the cancer center, I do breast cancer research, so I know plenty of physicians as well as scientists. I was able to get her in front of a doctor who does this quite a bit, and was able to give her a team to work with. And I guess fortunately and unfortunately, it was night and day. With that new with the doctor in the same exact system, she was able to see a doctor who, first of all, just calmed her down. And second was like, here's a packet, go home and read it. Here's a nurse. This is who you need to talk to. These are the meds we're going to give you. And if they work, if they work, they work. If they don't work, we have other things. Don't even worry about that stuff. I'll give you this option, because she gave her the same exact option, and then ask, how do you feel about it? And then my mom went home, she talked to the doctor, she talked to the nurses, and it was just, I was just astounded, because it was the same exact hospital, just a difference in doctors. And I was irritated by the fact that I had to get involved in the situation. So I think, in a way, almost, I mean, I guess you can't mandate it, but just making it so that everyone gets access to this type of system, it's almost imperative. In fact, it is imperative.
And it shouldn't matter who your provider is or where you're getting care. You should have this information, because honestly, it's really basic information. When we go to the Hill to talk about it and we show them what the sample care plan looks like, and it has diagnosis, prognosis, treatment options, whatever palliative care integrations going on, and a staffer just plainly goes, this doesn't happen. And it's like, yeah, it seems really obvious, and it's obvious there's a huge need for it. But unfortunately, it hasn't happened yet. But through all of your work, later this week, we're going to make it happen. We're gonna promote care planning and paid leave policy. Thanks to everybody's involvement today. This remains to be my favorite session every year. I love this. I love seeing you guys. I miss all of you. And thank you for Zach for joining us. You're awesome. The insights that you share with us, it's really, really valuable, and it helps us so much and helps prepare our advocates to go out and do the important work that they do. So we really, really, really appreciate that.
I appreciate all the work that you guys do. I'm just lucky to be able to be a part of it, and I really appreciate you reaching out to me, Lindsay. I wish all of you the best these next couple of days on the Hill. Don't hesitate to let me know if there's anything I could do. Lindsay, if you need anything, if anybody else needs anything, Lindsay knows how to track me down. So
unfortunately for you, I do.
Yeah. But seriously, you guys are going to be great. So I'm really excited for you, and I wish you the best.
Okay. Thanks, everybody. Feel free to reach out if you have any questions about Hill Week, and good luck.
Thanks, Lindsay. Thanks, Zach.
Everybody.
Good luck, everybody.